Today I want to talk to you about depression, signs and symptoms of depression. At the end of the speech, I will be handing out a handout that will have a website on it to a place you can go to and do a quick test to see if you have symptoms of depression. There are several types of depression. One is seasonal. It is when the seasons change and we have less sunlight. Another one is anxious distress. That is when we feel restlessness and we feel like we have no control over what we're doing. Another is postpartum, which is when women are pregnant, during pregnancy or after pregnancy. The most common in the United States is clinical depression. And it is a psychiatric disorder that affects 1 in 6 people in the United States. So 1 in this room has either had depression or is having symptoms of depression. Disorders are also a mask of depression. They're hard to distinguish the differences. One of those disorders is bipolar 1 and 2. You have high moods and you have low moods. Bipolar 1 and 2 is a mood disorder. It is not listed as depression. Another thing is outside factors of depression is recreational drugs. Also, medications that your doctor may prescribe can cause depression. And also medical conditions such as cancer, diabetes, or heart failure. Now let's talk about some things and signs and treatments of treatment options. To be diagnosed, you must have at least 5 symptoms of depression, either every day, all day, or 2 weeks in a row. These can be depressed mood, it can be agitation, it can be weight loss, weight gain, it can also be sleeping too much or sleeping not enough, it can also be restlessness, fatigue, loss of energy, and also feeling guilt or worthlessness, poor concentration, and the feeling of death or even suicide. The doctor suggests a couple different ways to treat depression. One is therapy. Therapy is used to give coping skills and also to help you see the signs when you're having problems with depression. Another is antidepressants. Antidepressants are started at a very low dose and they raise as they think is needed. They also take 6 to 12 weeks for them to be in your system to be at full effect, to see if they're helping. Some doctors suggest to do both. There is often other things they suggest as exercise, like biking, riding a bike, also running, walking. And the doctor also suggests when you do exercise to do 3 to 5 times a week and to do it for 40 to 60 minutes at 10 weeks in a row. This will change your routine and give you a different pattern. So now that we've talked about that, the last thing we're going to cover is techniques to help with depression. One of these is to also do exercise and to do breathing exercises. Breathing exercises can actually calm you down when you're getting upset or you feel like you're having an anxious attack. Depression is not a disorder that you can treat on your own. It's very important to get a doctor to help you with this. You can only do so much alone. You need to eat healthy. You need to have plenty of sleep. So, in conclusion, today we have talked about different types of depression. We have talked about different ways to help with depression. We've also talked about things you need to talk to your doctor about with depression. Some disorders are mimicking of depression. It's important for your doctor to distinguish the difference of them. We also talked about treatment. On the handout I'm giving you is also going to be a test for you to do, and you need to take this test to your doctor and discuss it with them. There's no way this is treatment in any way. This is only a tool to help you with your doctor. It's important that if you feel that you have depression, not to be ashamed and not to feel like you can't talk to somebody. Stigma keeps people from talking to doctors. They feel ashamed, they feel embarrassed, because they feel like that there's something wrong with them that they don't wanna, they can't get help for. And that's not true. So if you feel like you have depression, or you feel like you have symptoms, it's very important to talk to somebody. And it's very important if you see somebody else having these symptoms, that you talk to them and encourage them to go see a doctor. Thank you.